Today is March the 17th, St. Patrick's Day, 2021, here in Neepawa, Manitoba. We're at the beautiful Plains Community Medical Clinic to get an update on the vaccination rollout for Manitoba and how it pertains to Neepawa in particular. With me today is Dr. Desilets from the clinic staff here, and Kira Paterson from the Neepawa Banner and Press. Thank you, ladies, both for being here, and welcome. We're looking forward to some information regarding the vaccine rollout.
Mm-hmm. All right, I'm going to be doing a bit of an interview because I confess this is a double duty. I'm going to use the information for the paper, and obviously we're going to use the video for NACTV. So thank you for being here, Dr. Nichelle. So first off, how long have you guys been preparing to get a vaccine here?
So we became aware of vaccines that are able to be administered in the community at the same time as the general population. Mm-hmm. You may have seen it through the news media. Mm-hmm. When that started happening, the government invited community clinics and pharmacies to submit applications to receive allotments of those easier to handle vaccines such as AstraZeneca. And so they invited applications at that time. We did submit an application in early February with the hopes of eventually being able to provide a vaccine locally here in Neepawa to our patients in the surrounding communities.
And you said that it is the AstraZeneca, those ones that are easier to store in like a refrigerator rather than sub-zero temperatures. What is kind of the vaccine eligibility, that's the word I was looking for, the eligibility for the people to get the AstraZeneca vaccine? Right,
so that's a great question, and that's an answer that changes every day. Mm-hmm. So today is Wednesday, March 17th, and as I said, the criteria change every day. For the Pfizer and Moderna vaccines, those are the ones that you see being administered at the bigger super sites like Brandon and Winnipeg. Those are the ones that the criteria tend to change every day based on age and as they have availability. I believe the age may be 77 as of today, but I've been in the operating room and I haven't checked my emails, so that might not be quite right.
It's in the 70s somewhere. Anyway.
Yeah, so that changes every day, and that's for all comers. Anyone over that age who's interested, regardless of, you don't have to meet certain medical eligibility.
Right.
In terms of AstraZeneca, which is the other one that is currently being administered in Manitoba right now, those criteria, as it stands right now, are people aged 50 to 64 with certain medical criteria. There are also some other special groups, such as our First Nations populations, that have different criteria, usually younger. Mm-hmm. There are also some other special groups, such as people in community living, or congregate living situations, or some pregnant women with higher risk criteria that are being offered various forms of the vaccine. Okay. As it stands right now, there's a big long list of medical conditions that are being prioritized, and that's for AstraZeneca, and that may also change in the future, potentially maybe even at the end of this week or next week.
Right.
If anyone is ever confused about whether they meet eligibility criteria, there is a government website that stays updated on a daily basis with the criteria. And if you're not sure whether you meet those criteria, you're always welcome to discuss with your family doctor who knows your medical history best, because there is a little bit of detail with some of those criteria or some of those medical conditions, and people may not know if they fall into those categories.
Great. Okay, that's good to know. So do you have any timeline of when you expect some vaccines to arrive here in Neepawa?
Unfortunately, we don't. We applied and were approved early in the process. And as you know, a very small shipment of AstraZeneca vaccine has arrived in Manitoba and is currently being distributed in community pharmacies and clinics across the province.
Great.
Most of those allocations were very small, maybe 50 or 100 doses per location. And unfortunately, we were disappointed to find out that none of those were allocated to ourselves or any of our other local partners, such as pharmacies and clinics.
Great.
We're disappointed that if you look at the government website at current vaccine locations that do exist, there really isn't anything between Neepawa and Dauphin.
Right.
Or sorry, Brandon and Dauphin.
Oh, okay.
So there's a real paucity of availability in our area. Currently, the closest place that people could access any form of vaccine would be the super site in Brandon,
Okay.
or one of two current pop-up clinics, which are Dauphin and Portage.
Okay.
And a pop-up clinic is a clinic that only runs for a day or two and is designed to get a whole bunch of people through and then be done.
Right. Okay.
We are hoping that we will be allocated some in the near future, and we're ready to receive that and start administering it as soon as it becomes available.
Okay. And what were some of the preparations that you had to do to be ready to receive them once they do come?
So fortunately, giving vaccinations is something that falls well within the scope of a family physician, and something that we have a lot of expertise in. For example, many people receive the flu shot in their family doctor's office, or perhaps some of their childhood immunizations in their doctor's office, depending on their circumstances. So a lot of things don't change with a COVID vaccine. Some of the things that we have done to prepare is all the physicians have educated themselves on what makes the COVID vaccine different. It's been developed and rolled out a little bit differently than other vaccines in the past. We have looked at shifting our schedules and our availability to make booking a vaccine appointment efficient and timely, so that we're not sitting with vaccine in the fridge that's not being used. We want to have people come through and receive that as they see fit. And then finally, we have been looking at replacing our vaccine fridge for a while now, and this was a good opportunity to do that. So we did proceed with buying a new vaccine fridge.
Okay. So how, once or if you guys are able to get some vaccines here, how will people be able to get an appointment booked?
We have looked at different avenues there. If a person is unsure about their eligibility, once again we invite them to contact their family physician for a phone appointment to discuss that. And this also applies if they have any concerns about safety or whether they are on a medication or something that would work in the rare circumstance where we would recommend not getting the vaccine. In terms of booking appointments, patients would be able to phone into the clinic and book an appointment. And we are looking at trying to audit our patient lists to proactively seek out patients that we feel should be prioritized. We are fortunate that our clinic serves a very large number of people, not just from Neepawa, but the surrounding areas. And so just with the volume of charts that we would have to audit, it may be an imperfect process. So we invite people to feel free to inquire if they feel that they meet eligibility and would want to receive a vaccine here in the clinic. Finally, there are once again some special groups, such as people who live in congregate settings. For example, if they require assistance through disability services and live with multiple people or with assistance. And then once again, our patients that are receiving home care services. I hope that the community social workers and community home care staff can help advocate for their patients as well, and we'd be happy to work with those people to make sure that everyone who is eligible and wants to be immunized can receive that.
Yeah. So obviously you mentioned before that what has been rolled out to different areas in Manitoba has been very small amounts. Are you thinking that that may be the case later on, or do you think that there will be a ramp up of what is sent to Manitoba and what they are able to send out to the individual locations?
I don't know. Doctors community physicians don't receive any secret knowledge that other people don't get.
Right.
So I would not be surprised if there's still small amounts, especially as the government and the public health officials are targeting higher risk groups.
Right.
That being said, I am sure that the end target would be for a larger volume to be available to more people and for us to administer it faster. Much in the same way that the community flu vaccine campaigns work,
Right.
where there's a large amount, there's a large availability, and we invite people to come through.
Okay. Is there anything else that you really think that the public should know that maybe isn't necessarily common knowledge, or something that gets forgotten quite often in all of the messaging about the vaccines? Or
I would just reiterate what has been said in a lot of the media. Doctors feel that vaccines are very safe, and I know that there's a lot of concern about how vaccines are developed and how they're approved and things like that. But these vaccines are really safe. It's normal for people to have questions, and it's normal for people to be watching this really closely. And so it's normal to have questions, and for that reason we invite people to check out online resources that are available, reach out to their family physician or any other of their medical team to discuss those reservations and hopefully get the answers that they're needing. It is what makes this vaccine rollout probably different than what people are used to experiencing is the fact that the criteria are always changing, and that can be really confusing. So there are resources online that people can access. One good resource is manitobavaccine.ca, which is a website that's developed by doctors for the Manitoba public to get answers to some of the common questions that they may have with respect to the COVID vaccine. There's also an eligibility checker that's kept up to date, so you can answer some yes or no questions, and at the end it'll tell you if you're currently eligible or not. If you're not, you can opt to enter your email address and be contacted at the time that you do become eligible. And I think that will really allay some people's concerns with maybe missing their chance or not knowing when they're eligible. That's if you have access to internet and email, that's a resource that's available.
And in terms of missing their chance, that probably shouldn't necessarily be a fear among people, because once that eligibility is open up to those people, it remains open once it opens up more, right? Like, for example, it opened up to 77-year-olds this week, but the 80-year-olds are still eligible, even though it is getting a lower age group now, right?
Yes, what's happened in the past is that the criteria just get wider.
Right.
And from all the information that we've received, I have no reason to believe that the criteria would narrow again.
Right.
As more vaccine becomes available, the criteria will widen, more people will be eligible, and as you know, our goal is to have as many immunizations administered as soon as possible so that we can all kind of get back to doing things the way we'd like to do them.
For sure. I think that covered everything that I have questions, unless you had anything you wanted to know, Dave?
Well, perhaps the viewers would be interested. I'm assuming that the shots would be administered here in the clinic. Would there be a special location, and who would be administering them?
We are planning on administering them here in the clinic when we receive any allocated shipments. And the patients would be receiving their immunization with a physician. In order to facilitate a good workflow and maintain social distancing and get people seen in a timely manner, we are planning to book immunization appointments with any physician. So you may not necessarily be seeing your physician,
Okay.
which should not be a problem for most people. And if there is a preference, we would try to accommodate that. In terms of other places that would be available, community pharmacies, if they've applied to receive it, are qualified to administer the vaccine. And then in terms of more formal, larger clinics, like our community influenza vaccine campaign that happens in the fall, as of today, I'm not aware of any of those pop-up clinics occurring in our local area. The nearest ones that I'm aware of are Dauphin and Portage, but things are always changing, and that could definitely become available in the future.
Yeah. Just to reiterate, the contact would be through the clinic here, though. They wouldn't be phoning the Manitoba number, for example. They would phone the clinic here?
No. So any appointment that gets booked at a super site or a pop-up clinic would be booked through the provincial phone number, which is the ManVac phone number, 1-844-626-8222. That's the phone number where you can go through the system and book at the larger public health run clinics.
Okay.
If you were to be seeking an AstraZeneca vaccine in a community pharmacy or a clinic, you could contact that pharmacy or clinic directly.
Okay. So that would be the Beautiful Plains Community Medical Clinic for the shots that you're referring to?
Absolutely. Yeah. You would call just like you were booking a regular doctor's appointment.
Okay, that's great. And one other question, thing we haven't touched on is the second shot. Do you know anything about the second shot as to time length or whether you'd be involved or how that might work?
We don't know that. Initially, when they were planning on rolling out the AstraZeneca vaccine to community locations, they were recommending that we book the first and second shot at the same time with the original recommended interval. Now, as you may have seen, there's some evidence that spreading things out up to 4 months might be acceptable or even advantageous. So I am not sure what the current recommendations are for that. The government is providing resources on the specific vaccine that gets allocated to community locations, and we will follow whatever guidelines are recommended from public health. So that may be a short interval or it might be a longer interval.
Right. Well, thank you very much, Dr. Desilets and Kira, for the interviewing today. The viewers, I'm sure, will be extremely interested in this program. Thank you very much.
Thanks.